With that, let's jump into our slides. Here again, you just see the progress we're making towards that initial goal of vaccinating 75%. We are 86% of the way there, 86.7% of the way there with first doses, 63.8% of the way there with second doses, or with fully vaccinated, I should say. The population and goal population numbers will change. Once we open up to 12 to 15-year-olds, we will add those eligible folks into our calculation. And so you could wake up tomorrow and see these numbers dip a little bit. And the reason for that is just because we have increased the eligible population once 12 to 15-year-olds are eligible. But again, you see 3.2 million doses administered, and we feel very confident about where we're going there. Next chart, this is what I was alluding to earlier, that case rate. We've had some days, yesterday was 125. We've certainly had some days down. But again, 94, you got to go all the way back to May 31st of last year, a day that we reported 73 cases. You have to go all the way back to this month a year ago for a single day, any day, when our case count was under 100. And the day-to-day numbers, as we've often said, are not important. They go up and down a little bit. But I think what you see here is our percentage of positive low, our case rate low, and generally positive news overall about what we're doing. The next chart here, again, we're just showing the totals for what was actually received. You can see right there this week, 302,000, so up 50,000 from last week. Still not an all-time high. That happened a little bit earlier this month, but we have plenty of vaccine to be able to meet the need, and we think next week's totals will be even higher than what we have now. So we just want the public to know there are vaccines available. If you haven't gotten in now, please do. We want to continue our progress towards getting folks vaccinated. Next slide here is an update on some mobile sites, and this is also available on our website. And this is a listing of dates along with community locations. You can see markets, senior centers, partnerships with the Catholic Church and other religious institutions, community groups, businesses, the consulate, community colleges, libraries. Again, we're doing everything we can to get out into the community and set up mobile vaccination sites where folks can drop in and get their shots. Again, to reiterate, if you have a 12 to 15-year-old, please do not show up at one of the mobile sites. We cannot guarantee there will be Pfizer available. The mobile sites are primarily using J&J vaccines. Makes it a little bit easier to not have to come back to the same mobile site 21 or 28 days later. But Pfizer will be available at all of our static locations throughout the county, and we encourage folks to go to our website. And a number of folks will just go to your healthcare provider. You can always reach out to your pediatrician or your healthcare provider, and once they are approved, they will be eligible as well. And then the final chart here is just our weekly thing. And again, you can see our case rate had a pretty significant drop there from 5.0, our adjusted case rate last week, down to 3.7. And so we think this is a good testament. Again, as we talked about last week, probably not likely we get into the yellow tier before June 15th. Certainly could happen, but I think unlikely. We'd have to continue descending at the rate we did, and we're probably going to run into June 15th before we would get to that point. But we are encouraged to see our case count descending, our unadjusted rate lower, our adjusted rate lower, our testing positivity percentage lower, and our health equity testing positivity percentage lower as well. And so we think this represents continued progress.